Hello and welcome everybody. Thank you very much for tuning into Blues News Media, and I am your host, Lucas Tietzen. I hope everybody's doing well today because, as always, we have a terrible, terrible news story here for you. And you might have all seen this, but it does bear driving home. As you are kept sheltered in place, the Congress critters that are representing you are hard at work to make sure that your rights are eviscerated. And that is no better exemplified than in this little House resolution right here. House Resolution 6666. They're not even trying at this point to hide their intentions. But what is HR 6666? Well, it does go by a different name, and that is COVID-19 testing, reaching, and contacting everyone, also known as the TRACE Act. So we're going to go over what exactly is the TRACE Act here, and with that, some other little news articles that bear keeping in mind as they try to push this thing through, this piece of garbage, really. So, in short, this bill is to authorize the Secretary of Health and Human Services to award grants to eligible entities to conduct diagnostic testing for COVID-19 and related activities such as contact tracing through mobile health units and, as necessary, at individuals' residences and for other purposes. Now, there's a lot to unpack in there. So, basically, the Secretary, the Health and Human Services, is going to be awarding grants, money, to eligible entities, which they do go over later in this bill, to conduct diagnostic testing for COVID-19. And we've been seeing this everywhere. They are ramping up testing right now. And related activities. So not only is this including expanding testing, but it also is going to talk about contact tracing, which is really just a pretty word for ultimate surveillance at all points in time with basically everybody. Say you're infected, everybody that you come in contact with will be a potential case, and those people need to be monitored then. It is completely Orwellian. It is the ultimate panopticon. And they'll be conducting this through mobile health units. And then, if necessary, these mobile health units will come to individuals' residences. And then, of course, we need to keep the door wide open and for other purposes. So whenever they need something to fit the bill, they can always look to this beautiful, short excuse for other purposes. The short title: this act may be cited as the COVID-19 testing, reaching, and contacting everyone, also known as TRACE Act. In general, the Secretary of Health and Human Services, through the Director of the Centers for Disease Control and Prevention, or Proliferation, may award grants to eligible entities to conduct diagnostic testing for COVID-19 to trace and monitor the contacts of infected individuals and to support the quarantine of such contacts through mobile health units and, as necessary, testing individuals and providing individuals with services related to testing and quarantine at their residences. That's so weird how they're gonna help you make sure you don't leave your home. Gosh, that's honestly really nice of them. So, but let's see here. So they're gonna award some money to entities to conduct more diagnostic testing and to trace and monitor contacts of infected individuals. And we already see this happening right now. All over the media, they are talking about hiring an army because right now they're likening this to Pearl Harbor or 9/11. This is the world's new World War II. It is the global event. And with that, we need a new righteous army to vanquish this wicked virus. And we need an army of contact tracers. They will be needed in coronavirus fight. Experts say that could cost billions of dollars. Congress will need to appropriate $3.6 billion in emergency funding for the effort, including for the hiring of 100,000 contact tracers, according to the report. And it opens with data continuing to suggest New York is flattening the curve in the spread of the coronavirus, Governor Andrew Cuomo said this week that the next phase in the battle for his state and others is on the horizon: contact tracing. But it will come at a hefty cost. The labor-intensive commitment involves identifying those who have tested positive for COVID-19, the disease caused by the coronavirus, and interviewing them to find out where they had gone and whom they've come in contact with, an effort that has been effective in controlling other outbreaks, including tuberculosis and SARS. Before stay-at-home restrictions can be loosened and states and cities can begin the fragile process of emerging from isolation, public health experts warn that more people must be tested and then isolated through contact tracing to further diminish the virus's spread, while tracking who is healthy enough to go out. I like how they keep moving the goalpost in this. Remember when it first started, it was, all right, we'll shelter in place for a couple of weeks and it'll all be done. We can go back to work. I mean, it's been how long now? Month and a half, going on 2 months, and you know they're just going to keep expanding it. They're going to keep pushing this thing out as long as they can. And while they're at it, they're going to literally hire an army of people to track you and where you've been and who you came in contact with. The very basic privacy of interacting with another human being will now be known by the state. It continues with, a contact tracer is a detective, an investigator in the public health space, Cuomo said during a news conference. That is a massive undertaking, an army of tracers. But a recent report estimated that the high price tag for the implementation will require federal assistance, hence this nice new bill. Congress would need to appropriate $3.6 billion in emergency funding for the effort, including for the hiring of 100,000 contact tracers, paid or volunteer, according to the report from the Johns Hopkins Bloomberg School of Public Health and the Association of State and Territorial Health Officials. Now, I mean, this is great. I understand why they're doing this first. It's much more comfortable to think that a person is going to use detective work. They're going to investigate where you were and where you have been. They need nothing to do with that. There is no need for the human to be there, but it is easier for people to accept that a human is going out there and investigating these things. And they don't even need to investigate. They just need to look at your geolocation data in tandem with the rest of the population to see where you were, when you were there, where you came from, where you're going, and just by chance and through whatever time window, who may have crossed your path at that point. Well, then those people are suspected threats. Infected, whatever you want to call it. But this is just the beginning. This is just the soft implementation, the soft rollout, because I bet you that in the future, in the near future, the need for humans to investigate where you've been will become obsolete, because they will use AI. They will use artificial intelligence in order to track, record, and store your location and who needs to be investigated next. And in this article, called "A Facial Recognition Company Wants to Help with Contact Tracing," a senator has questions. We should all have questions, not just this one senator. I don't know if you guys remember Clearview AI. As this article goes on to say, they were the company that was responsible for scraping data from social media sites. They were literally taking people's face and storing it in their databases, and then creating this unholy partnership with law enforcement for them to go ahead and run a person's face through there to see if they could get a match, even though there were so many cases of inaccuracies and this software being racist and mainly being inaccurate against minorities, is now trying to get a nice cushy little contract with federal and state governments in order to track you listening right there, and me, of where you've been and when you were there and who you came in contact with, and then the tracking of those people and where they've been, who they may have come in contact with. And it's just going to be this chain reaction. I feel like people aren't understanding that. It's going to quickly explode into this huge net of everybody needs to be isolated. Everybody needs to be quarantined. Everybody needs to be surveilled. This is where it's going to be heading. They're going to use artificial intelligence to actually implement this contact tracing. And it's not, we should really stop using those words, contact tracing. We should really start calling it surveillance. They're going to be constantly surveilling you. But maybe it's just me. And then let's say you do, through one way or another, get caught by these army of contact tracers or in artificial intelligence. Last week, you were at the grocery store. You were buying noodles at the same time this other person was buying noodles. Well, lo and behold, that person tested positive for COVID-19. You're a suspected case now. You need to be tested. We need to make sure that you can be tested. And that's why we have these nice little mobile health units that are going to be funded through this bill, if it goes through. Probably when it goes through. And now, sure, you're going to have medical personnel there conducting the test, but we also see all throughout the country, it's not just medical personnel, because we've been seeing a great mobilization of the National Guard. They will be a part of this structure because not only are they there to help with testing, I mean, if you're going to ramp up testing, you're going to need more bodies. And if there aren't enough medical personnel, well, it's a state of emergency. Get out those boys. The National Guard will be on your street conducting tests as well. This is from Wisconsin. I'm personally from Wisconsin, so I've been finding a lot of stuff like that. And yeah, this says National Guard to more than double units assisting in COVID-19 response. All nursing home residents and staff to be tested. And I feel like they just keep doing this. I've mainly been following Wisconsin with some eyes on other states. But this is like the second or third time we've doubled it. We've doubled the number of National Guard going out there. And I just wonder when is it going to stop? When do you cap out? But let me go ahead and read just a bit of it for you. As nursing home staff make themselves available to help the at-risk elderly residents they serve, John Van Der Meer wants to make sure they have access to some peace of mind. Wisconsin's frontline caregivers are heroes, Van Der Meer said. They're doing everything possible under very difficult circumstances to protect the health and safety of the residents they serve with caring hearts and serving spirits. As president and CEO of Wisconsin Healthcare Association / Wisconsin Center for Assisted Living, which represents hundreds of facilities serving the elderly and intellectually and developmentally disabled across the state. Vandermeer said staff such as providers have faced barriers in getting tested for the virus. He said he's grateful the state will begin providing free testing to all residents and employees at Wisconsin's nearly 400 nursing homes. Testing availability has been a challenge around the country, including here in the state of Wisconsin. I think the folks at the state level are doing the best they can, Vandermeer said. This is something that really the association and provider community has been fighting for a long time. Plans for long-term care facility testing is part of an announcement from Governor Tony Evers outlining goals to increase testing. The plan includes 4 major goals: test every nursing home resident and staff member, respond to every outbreak throughout the state, establish community testing programs in target communities, and make sure everyone who has COVID-19 symptoms gets a test. The Wisconsin National Guard will be mobilizing additional teams to help in these efforts. According to Captain Joe Trovato, the Guard has already about 11 mobile groups helping with testing in nursing homes, correctional facilities, factories, and communities across the state. Within a week, he said they will add up to 15 additional units. As part of the Guard's COVID-19 response, those units will help at drive-through sites and communities throughout the state, offering free tests to those with symptoms. This is just an instance in which we can support our fellow Wisconsinites and hopefully come out on the other side of this sooner than later, Travato said. The goal across the whole state is to continue to increase the state's testing capacity. The more that we do that, the closer we are to getting our state back in position where we understand what issues we're actually facing, and that information is extremely valuable. Now, me just being me, when the government comes and says the plan includes 4 major goals: test every nursing home resident and staff member. I understand the staff members. They are assisting people that are at risk. Sure, you can make an argument that it should be maybe mandatory for them. You can make that argument. But then you have the nursing home residents. What if grandma didn't want to get tested? What would happen? And I think this is a very serious question. What if somebody actually wanted to refuse a test? Can they do that? Or does the state wield so much power that they can either force a test on you, or you could actually be fined or detained for refusing to submit to a medical test? And then there's the whole issue about medical treatment as well. He just, floats this out there as if it's no big deal. And many people, they just gobble it up. Understandable. A lot of people are scared. Well, what about the people that value their right to their own body, that value the right to saying what can be done to them? What if they want to refuse? What would happen? I'd be curious to know. But then respond to every outbreak throughout the state. Establish community testing programs in target communities, and make sure everyone who has COVID-19 symptoms gets a test. The symptoms, and everybody has said this, for COVID-19 are so broad. You can fall ill and you don't know if you have it. You could have a dozen different things. If I have a cough, if I'm not feeling well, It could be COVID-19, or it could just be a normal cold. If somebody comes to my door, do I have to submit to the test? I would like to know. And I would not be shocked that in the near future, that if you or even a person on your block were to fall victim to this COVID-19, either testing positive and being asymptomatic or actually showing severe symptoms, I would not be shocked if you saw the quarantine of your entire block and then the systematic administering of tests in conjunction with the National Guard, aka the strong arm of the state, to force test everybody, effectively eviscerating your rights. I'm sorry, it eviscerates your rights. And maybe you don't like your rights, that's fine, but I personally do. It's scary. It is scary, especially since you have people like this at the helm trying to direct people's way of thinking. I usually don't like Breitbart, but it's the only way I could find this. Coronavirus. World Health Organization official floats removing the infected from their homes to stop the spread. This guy is really... he's a piece of poop. I don't know. I don't want to swear too much on here. This guy is Dr. Michael Ryan. Get a good look at him. You've probably been seeing him around there, especially with this other scum lord, the head of the World Health Organization, both in the pockets of Bill Gates, by the way. But he has come under fire from people that value their liberty and fear tyranny, but then are praised by the, I don't like to call people sheeple so much, but people that praise the status. And there's a bit of a transcript right here that I'd like to read for you. And it is as follows. A reporter says, I wanted to ask, we've seen some different approaches to quarantine in China and in European countries with group quarantine used to good effect in China. Do you think that home quarantine will be as effective anywhere for people who are positive, or would central quarantine be needed in order to have the same success that China has had? Dr. Michael Ryan responds, yes. Just so we get our terms right and we can explain ourselves properly, we tend to use the word isolation for someone who is a case, confirmed. We tend to use the word quarantine for someone who's at risk of being a case, usually a contact. So on that basis, we advise that all suspect cases are treated and all suspect cases are isolated in an appropriate medical facility. I think nobody disagrees with that, where the capacity exists. When we come to contacts, it very much depends on the context and the intensity of any given moment. In low incidence areas where there are sporadic cases or clusters, we advise that all contacts should be quarantined. Ideally, that quarantine should occur in a place other than the home. And for this reason, one, because if that person gets sick, they may already have infected their family. But that's not always possible, so at least quarantining contacts at home with good health advice about not transmitting disease if they become sick and with regular monitoring of that individual is an option for countries. It is difficult to do that in the middle of intense transmission where you might have hundreds of thousands of contacts because you're having thousands of cases a day. It is difficult to deal with that. So home quarantine of contacts is acceptable with appropriate information, education, and, more importantly, a very rapid system of getting those people out of their homes if they become sick. I listened to the president of Singapore this morning as he had a conference call with the Director General, and the clarity of that in Singapore, that ability not only to isolate cases but to rapidly detect illnesses in the contacts and remove those contacts should they become sick was a central part of that. As he said, they're using apps now to do that. They're testing apps. But they didn't do it with apps in Singapore. They did that with community workers, with public health workers visiting the houses, checking on people, checking their health status every day and saying, "How are you? Have you got a fever? Have you got a cough?" And if a contact had developed a cough or a fever, if they were taken immediately for testing. So yes, we need the information technology tools. They help. They're not the solution. Right now, we don't have an alternative to what we would have considered in the old days boot leather epidemiology. Public health practitioners, doctors, nurses, community workers working with communities to detect cases at community level. And the most likely person to become a case is someone who's been a significant contact with, of another case. And at the moment, in most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now, we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner. So that's why I was saying previously, the transition from movement restrictions and shutdowns and stay-at-home orders can only be made if we have in place the means to be able to detect suspect cases, isolate confirmed cases, track contacts, and follow up on the contact's health at all times, and then isolate any of those people who become sick themselves. So right there, this man is saying, if you develop symptoms, if you get sick in this very intense climate, you need to be removed from your home. What if your child, and children get sick all the time, what if they develop some sort of symptoms? Would they be removed from the home? What if I am the only adult in the house and I have children? What if I get removed from the home? What happens to the children? I feel like they're just saying these things. They're literally talking about ripping apart the family in the name of stopping the spread. This is incredibly, incredibly dangerous. And people like him are helping guide global health policy so that this sort of measure could become a reality. Who knows? Maybe not in this one. Maybe not in this pandemic. But what about the second wave or the third wave that they've already basically baked in the cake into this narrative? These sorts of measures can be implemented, and they probably will. They probably will. And I guess the big question is, are you okay with that? Are you okay with the World Health Organization or state or local officials in conjunction with the National Guard coming in and, one, testing you, possibly even force testing you, and then maybe even removing you forcefully from your own home? Does that seem okay? Does that seem right? And do people have the right to refuse? It's kind of a big part of this, though. You may say, I should have the right to refuse. I am my own person. I know what's best for me. I should be able to make a choice and live with the consequences. You would think you have the right to refuse. But unfortunately, there have already been measures put in place over a decade ago for just this sort of scenario, for just this sort of instance when people may get the idea of, I don't want to be removed from my house. And let me show you this. So back in, if I'm not mistaken, 2003, the CDC, Center for Disease Control and Prevention, or Proliferation, as I like to say, drafted this thing. It is the model, what do they call it? Hold on. It was the, it's like Model Emergency Health Powers Act, if I'm not mistaken. I don't think it's on here. But the point of this, it was a draft legislation. It was just a framework for states to take and independently adopt, pass. And the gist of them all was to basically waive the public's right to their own health in the state of an emergency. In many of these here, and I'm going to put this in the show notes so you can find your own state and see what exactly is on the books. This is from 2007, but I can guarantee that it is probably in your state. I mean, right here, it says 48 of these bills or resolutions have passed. And this is, to date, 33 states have introduced a total of 133 legislative bills or resolutions. And this was over a decade ago. So I guarantee you that there are more on the books, and seldom do these things get repealed after the fact. But just for an example, like we'll go down to mine, my state of Wisconsin. So in the event that there was some sort of public health emergency, this is the big one right down here. It is an act relating to public health planning, services, and functions, reporting on communicable diseases, public health agreements, required vaccinations, isolation or quarantine, contracts between municipalities and federally recognized American Indian tribes or bands, and requiring the exercise of rulemaking authority. Basically, if they wanted, legally, they could require vaccinations, which is just another word to force vaccinate you, or force you into isolation, maybe even removing you from your home, or quarantining you in your own house. And they'll know if you leave. They'll know. One, they'll know either because you'll take your phone and they use your phone's geolocation data to track you and to see who you came in contact with. And they'll be using that once again through things like with artificial intelligence. So they'll be able to know just like that. But let's say you become privy to all of this and you want to move away from your phone in order to leave your house without being spied on by a big daddy government. Some states, not that one, even though that's a good one too, are even using this. To keep COVID-19 patients home, some U.S. states weigh house arrest technology. It opens with, as the United States begins reopening its economy, some state officials are weighing whether house arrest monitoring technology, including ankle bracelets or location tracking apps, could be used to police quarantines imposed on coronavirus carriers. But while the tech has been used sporadically for U.S. quarantine enforcement over the past few weeks, large-scale rollouts have so far been held back by a big legal question. Can officials impose electronic monitoring without an offense or a court order? Case in point is Hawaii, which considered the sweeping use of GPS-enabled ankle bracelets or smartphone tracking apps to enforce stay-at-home orders given to arriving air passengers, according to Ronald Kauchi, the president of the Hawaii State Senate. I'm sorry if I'm getting his name wrong. Kauchi said Hawaiian officials were concerned that many travelers were floating the state's 14-day quarantine order, putting the archipelago's inhabitants at risk. But he said that the plan for mass tracking of incoming travelers inspired by similar technology in place in South Korea, was put on the back burner after the Hawaii Attorney General's office raised concerns. America is America, Cauchi told Reuters. There are certain rights and freedoms. In response to written questions to the Attorney General's office, Hawaii's COVID-19 Joint Information Center said quote, various ideas being evaluated for tracking those under mandatory quarantine in response to the COVID-19 pandemic are right now just that, ideas. Similar ideas have already been executed in a few other states, albeit on a much smaller scale. 7 people who broke quarantine rules in Louisville, Kentucky were court-ordered to wear GPS tracking devices manufactured by Colorado-based Scram Systems, according to Amy Hess, the city's chief of public services. She told Reuters that while she would rather not have had to use the devices at all, state law permitted the imposition of home confinement to protect public health. Anything in the name of public health. We don't want to take away people's freedoms, but at the same time, we have a pandemic. What can you do? In West Virginia's capital, Charleston, Kanawha County Sheriff Mike Rutherford told Reuters his force had leased 10 additional location monitoring ankle bracelets from Geo Group Inc. at the outset of the epidemic to be on the safe side, although, he said, they've so far just sat on the shelf. Industry executives, including Shadow Track Technologies, Inc., President Robert Magaletta, whose Louisiana-based company supplies nearly 250 clients across the criminal justice system, said they had fielded calls from state and local governments about repurposing their tools for quarantine enforcement, although they wouldn't name the prospective buyers. So, I mean, right there, they are floating this idea of using, quite literally, house arrest technology that you cannot take off. That's the purpose of it, right? To make sure that you abide by these rules, you abide by these laws. If it's not sinking in yet, under a tyrannical state, a tyrannical government, also known as the United States, you have no rights. You have no freedom. But that was just, honestly, that was just the first part of this whole thing. But then it gets on into who will get the funds, right? It says a grant recipient under this section may use the grant funds in support of the activities described in subsection A, which were incredibly broad, and also to hire, train, compensate, and pay the expenses of the individuals, like the army of contractors that are going to be needed until they just use AI to implement it all. And probably, the National Guard is going to need a cut too. They need to get their salaries paid. And to purchase personal protective equipment and other supplies. Just leaves the door wide open for interpretation. Priorities in selecting grant recipients under this section, the Secretary shall give priority to applicants proposing to conduct activities funded under this section in hotspots and medically underserved communities, and applicants that agree in hiring individuals to carry out activities funded under the section to hire residents of the area or community where the activities will primarily occur, with higher priority among applicants described in this paragraph, given based on the percentage of individuals to be hired from such area or community. So they'll obviously be rolling this out in hotspots like the bigger cities, mainly, I'm sure, New York. New York's going to be, if you're still in New York, I highly recommend you get out of there. Distribution. In selecting grant recipients under the section, the Secretary shall ensure that grants are distributed across urban and rural areas. And I'm definitely sure they want to keep a track on rural Americans. They're the ones that fell most to the propaganda of that they are free, that they have rights, that they don't need to follow every dictum of the state. Certainly, those people are going to get hit hard by COVID-19. Federal privacy requirements, and this was very interesting. It says nothing in this section that shall be construed to supersede any federal privacy or confidentiality requirement, and then referencing some older health acts. And whenever it comes to privacy ensured by the federal government, it's hard to hold back my laughter. Like, there is no privacy. And then it goes into some of the definitions of eligible entities, the people that could be receiving the grant money. And there are many. A federally qualified health center, school-based health clinics, disproportionate share hospital, academic medical center, nonprofit organization, institution of higher education, a high school, and any other type of entity that is determined by the Secretary to be an eligible entity for the purpose of this section. Again, just wide open. All these things, and also whatever the hell we would say at a moment's notice, it doesn't really matter. The term emergency period has the meaning given to the term in section 113G1B of the Social Security Act. And I'm sure, what's my kitty? Emergency periods and states of emergency. I mean, we're always in a state of emergency, so I don't even know. I'm sure they put that in for legalese. Term hotspot means a geographic area where the rate of infection with the virus that causes COVID-19 exceeds the national average. And we can go into the whole how they count things too. Like, it's also very arbitrary and it is not uniform at all. The term medically underserved community, I was looking into that, actually means like lower income places and the homeless. And the term secretary means the Secretary of Human and Health Services. Sure. Last but not least is authorization for appropriation. To carry out this section, there are authorized to be appropriated no less than $100 billion for the fiscal year of 2020. And I don't know if you know this, guys, we just exceeded $25 trillion in the United States national debt. And now, I mean, it's going to be interesting to know where this comes from. Is it going to come from you and me being robbed and then once again financing our own enslavement? Or are they just going to hit up the Federal Reserve, have them print out $100 billion every year? Because it even says here, such sums may be necessary for each fiscal year of 2021 and any subsequent fiscal year during which the emergency period continues. Baked into the cake that this whole scheme of tracing and tracking you and funding your own panopticon enslavement will be able to just, resubscribe for each subsequent year. Because, as I've stated before, they baked it into the cake of the narrative that there will be a second wave, there will be third waves. This is not going to be the end. This is just the beginning. And they want to make sure they have hundreds of billions of dollars in order to keep tracking you. This is all very concerning. And once again, I will always have the articles that we referenced here in the show notes for you to read, and I truly hope that you do so. I hope you enjoyed this. This is a very important bill, not gonna lie, not to mention it's kind of satanic at the same time. I hope you got a lot out of this. I know I did just researching it, and I hope you take a moment to like, share, subscribe this video. Any support that you can give me and Blues News Media is greatly appreciated, and I do thank you for listening. But as always, you can find me at many different social media sites. You can find me on Facebook, Twitter, YouTube. We started a BitChute. We're on Library. I think I have a little list up here. Oh, we are on minds.com also. So any of those, if you could follow me on those, share this video, but more importantly, just share this information. If you don't want to share me, that's totally fine. We need to get this out there. We need to start waking people up to what is going on, and we need to do something, some sort of action. Any action is better than no action, whether it be that you want to talk to your friends and family about it. That's an action. Print up flyers and hand them out to people, or put them in mailboxes. That's an action. Call your representatives. That's an action. Write letters to the editor. Like, use your beautiful creative mind. Honestly, there is no wrong answer. The only wrong answer is sitting at home and doing nothing while you watch the world fall apart. Or even worse, applaud and clap for the tyranny that is descending on you and locking you in. Anyway, thank you very much for listening to Blues News Media. I'm Lucas Tietzen. And remember, if you take one thing away from this podcast, hopefully it'll be this: ignorance isn't bliss.